So once again, good morning or good afternoon, everyone, depending on which part of the country you're in, but very excited that you're able to join us today to hear about the webinar, Improving Mental Health at Work, Promising Practices for Implementing the National Standard of Canada for Psychological Health and Safety in the Workplace. Myself, I am Nitika Rawari. I'm the manager for workplace mental health in the areas of research, evaluation, and knowledge translation, as well as the lead on the case study project that we'll be talking a little bit more to you about today. And before we do get started, though, I would like to inform you about some of the technical pieces on the webinar and on your screen that might be helpful to you. I do invite you to send any questions or comments throughout the webinar using the chat function, which can be found on the right of your screen. If you don't see the chat feature, look for the icon on the upper right-hand corner of your screen that says chat. It looks like a little bubble. Click on that, and then a chat window should appear on your right of the side of your screen. When you are sending your questions, we encourage you to please use the drop-down menu and select all panelists. This will ensure that myself, as well as our guest speaker, is able to view your questions. This webinar is also being recorded, and it will be posted on the MHCC website in the webinar archives section following the presentation in a few weeks. As well, due to the large number of participants today, we have muted all of your phone lines to eliminate any background noise, but please ensure in addition that your phone lines are muted and your computer phones are muted as well. With that, I once again welcome all of you to attend our webinar today. I'm happy to inform you that about 3 years ago, we began at the Commission a case study research project. This was a project that we wanted to have 40 organizations follow them over 3 years to see how the National Standard for Psychological Health and Safety in the Workplace really does implement in different variety of environments and different industries and sectors across the organizations and country in Canada. We wanted to understand what are the barriers to implementing the National Standard for Psychological Health and Safety in the workplace, as well as identify some promising practices to ensure that we can determine a strong business case for encouraging employers across the country to implement the national standard. This, of course, also informed any future revisions to the standard and was able to identify tools and resources that will help and assist employers in their implementation journey moving forward. With that, I want to highlight for you some of the great and courageous organizations that participated in this project over the last 3 years. We had over 40 organizations participating in the project. And as you can see from the logos of the organizations appearing on your screen, some of these organizations had national reach, some had provincial, some had regional reach. Some were part of a public sector, some were part of a private sector, some were large organizations, some were small organizations. In fact, we figured out that there were quite a few different working environments represented within the case study project. We know that there were about 30 public sector organizations, 8 for-profit organizations, and 5 nonprofit organizations. We also know that we had a good representation of small, medium, and large organizations within the project. And of course, many of these organizations represented either a unionized, a mixed, or a non-unionized environment. And in fact, we know that approximately 250,000 employees were impacted due to the implementation of the standard through these over 40 organizations. That gives me a great pleasure now to introduce our guest speaker for you today, Dr. Merv Gilbert, a co-lead on the case study project and an adjunct professor at the Simon Fraser University, has been leading this project with other researchers for us for over 3 years. Dr. Gilbert is a principal partner as well with Psych Health and Safety Consulting Group that provides services and that enables organizations to foster healthy employees and workplace climates. He is a clinical psychologist with over 30 years of experience in direct clinical and leadership roles at regional, provincial, and international levels. Dr. Gilbert is also an adjunct professor with the Faculty of Health Sciences at Simon Fraser University, a member of the steering committee of American Psychological Association's Psychological Health and Safety Workplace Network, as well as a primary participant in the development, evaluation, and dissemination of resources of workplace mental health. Dr. Gilbert has consulted, published, and lectured extensively in the development of the implementation of best practices intervention, training, evaluation, as well as knowledge translation. He participates in program development, research, as well as teaching, and has presented a diverse array of forums on the importance of workplace psychological health and safety issues for individuals as well as organizations. It gives me great pleasure to introduce you to Dr. Merv Gilbert and for the rest of the presentation today, as he will walk us through some of the promising practices that we found around the case study project.
Thank you, Nitika. I really appreciate it. Next slide, please. First of all, I want to express my appreciation to the Mental Health Commission for their support, and particularly for the recognition on behalf of the Commission about the importance of conducting systematic research into how the standard is implemented. I also want to acknowledge the participation of a number of colleagues from across the country in our research team, including my fellow colleague, Dr. Dan Bilsker, and Mike Teed from Bishops, Elliot Goldner, who was director of Karma before his unfortunate passing just before Christmas, some other Simon Fraser staff, Dr. Kevin Kellaway from St. Mary's, Professor Karen Biron from Laval, Hélène Soulin-Tebe from Université de Quebec, so on. It was a real privilege to work with such a skilled and talented team, and I thank them all, and we all deserve credit. I should note on that it was a real pleasure as well to work with the organizations. I want to acknowledge the effort and enthusiasm of the organizations, and in particular key informants within the organization as well as organizational champions. They worked hard, we made them work hard, and the benefits I think will help all organizations. I would also point out, as Nitika mentioned, that there were 40 organizations that went through the entire project. We started with 43 organizations, so 3 were unable to complete the project. Frankly, that's incredibly impressive. If any of you have any involvement with any kind of research project, particularly something going over that period of time, you inevitably get dropouts. In this case, I think we did remarkably well in having the 40 make it to the finish line. I would note at this point as well that of the organizations who were unable to continue, they were for very good reasons. It did not reflect a lack of support for a standard or a lack of support for addressing psychological health and safety. There were just other circumstances that made it difficult to continue. For example, one organization went through significant labor action, which made it impossible to hold any meetings with staff. So that is a real reality. Those kind of things come up, and perhaps if any questions, we can talk about how to deal with those kind of challenges and change. Next slide, please. The approach we took to this was the goal of our research was to better understand the integration of an initiative, in this case a national standard, into a very complex system such as an organization, with the goal of improving workplace psychological health and safety. It's important to recognize this is a really unique question and requires organizational change at multiple levels. So it's a very complex issue. Next slide, please. There are 2 main approaches to evaluating any intervention, no matter how complex. Outcome evaluations assess the effectiveness of a program in producing change. This approach requires researchers to take an objective approach and to look at outcomes with no real interaction with the participants. So you basically, if you're doing any kind of intervention, you let the people involved participate, do that, sit back, and see what happens at the end. An alternate approach is what's called the process or formative evaluation. This is conducted to help determine how a program or outcome or impact was achieved, not necessarily the outcome itself. In this case, there's ongoing interaction with participants, continuous feedback back and forth. In the case of novel initiatives such as the implementation of standard, this is the appropriate approach. So this was a process or formative evaluation rather than outcome evaluation, with the goal of documenting the journey of the organizations as they implemented the standard, celebrating their successes, acknowledging some of the challenges, and so on. We also developed intervention and measurement strategies that were unique to this study, and I'll talk a little bit more about those in a moment. No, back up, please. Back one. Thank you. We also provided ongoing feedback to the organizations at several points in time. So each of the organizations got an individualized report at various stages in the project, telling them how they were doing, providing some additional materials, and so on. And the outcomes were seen as a work in process rather than the final result. I should also note, and this is important to note, that the Mental Health Commission and its key partners, key stakeholders, were very actively involved in providing supports for the organizations. There was an expert panel that was available in monthly conference calls providing information. There were various resources provided by the Commission and other partners and so on. So it was a very engaged process. Next slide, please. So as I mentioned, in order to do this research, we needed to develop measures that were specific to this purpose. So we gathered qualitative and quantitative data from multiple sources, the key sources being the employees, key stakeholders, key stakeholder being a representative of the organization, who was our main contact person, and organizational champions within the organization. So these are usually senior personnel who, as the name implies, champion implementation standard. We hope that these measures will continue to be available to future organizations as they implement the standard. We received a lot of feedback from organizations that the measures themselves helped provide them with information, helped them both gather information and focus their efforts. So before the organizations started the project, all of them signed an agreement with the Mental Health Commission and provided an expression of interest, indicating why they were participating in the study, why they wanted to implement the standard. We also created a tool called the Implementation Questionnaire, which basically looks at the key items within the standard itself and asking how people are doing in each of those expected requirements. We asked people to complete another measure called the Organizational Review, which primarily is a method of gathering relevant data about, for example, indicators, short and long-term disability, EAP utilization, and the like, as well as information on existing programs and policies relevant to psychological health and safety. We also conducted interviews at various points, again with key informants and with champions, to flesh out the quantitative information we received. We also developed a specific measure to get employee input with respect to their awareness on psychological health and safety initiatives. And we had a specific questionnaire for the champions themselves. So very, very complex array of information was gathered. Next slide, please.
Merv, as we move to the next slide, I just want to say that your voice seems to be fading a little bit, so if you want it to be a little bit closer to your speaker, that'd be great.
Thanks, Ninika. Okay, how's this?
That's perfect.
Okay, next slide, please. So this is the timeline for the project over 3 years. As I mentioned, we gathered data at the baseline, so when this project began, and an interim process where we had a different set of measures and so on, and a final data collection at the end of the project. So all of this information was gathered, and each of these stages, as I mentioned, led to a report that was provided back to each of the organizations. So again, this complex interactive process. Next slide, please. I want to talk about this one first. This is sort of an overall slide about how the organizations did. This graph demonstrates the overall progress across all 5 elements of the standard, as well as the progress in each of the 5 elements of standard implementation. For those who are perhaps less familiar with the standard itself, there are 5 key elements to what's called a psychological health and safety management system: commitment, leadership, and participation, planning, implementation, evaluation, corrective action, and management review. So this really is sort of the summary slide. So a couple of comments on this that are important to note. First of all, none of the organizations started at scratch, if you will. All the organizations started with some compliance with aspects of standard, the 5 elements of standard, even if they hadn't named them that way. So I think it's a really, really important message to any organization. You're not likely to be starting from zero. You're already doing a number of things that are consistent with the standard. So that's very encouraging. On the other end of things, no organization was 100% in compliance. No one had fully implemented the standard. This is in no sense a criticism. It reflects the fact that the standard is, frankly, by definition, a process of continual improvement. So, frankly, if someone had told us they'd fully implemented the standard, we would have been suspicious. So that's important to note as well. I will comment a little bit as well. You'll note that some of the areas where organizations struggled a bit more, and not surprisingly, were in the elements of evaluation, corrective action, and management review. That partly reflects the fact, particularly management review, that is something that is an ongoing process and so on. And although the project was 3 years, that really is a relatively brief time for significant organizational change, such as required by the standard. The evaluation piece I'm going to talk about a little bit further in the presentation, but that continues to be a challenge for a number of organizations. Next slide, please. Okay. I'm going to talk about 3 key lessons that we learned. I do want to stress that we learned a lot more than 3 things. It would have been an inefficient use of time and money if there were only 3 things that came out of it. I strongly encourage all the participants in the webinar today to check out the actual reports that are available from the Commission and so on, where we provide a lot more information about the kind of barriers that the organizations encountered, some of the facilitators, and some of the best practice for implementation. However, for the sake of this session and within our time limit, I wanted to focus on 3 key points. Next slide, please. The first thing I want to talk about is ensuring commitment across the organization. This reflects the first element of psychological health and safety management system, which is commitment and clarity at the start. Next slide, please. Okay, let's talk about commitment for a moment. Commitment includes a number of different elements. Organizational change is required to implement standard, requires leadership. That's something of a cliche that's kind of obvious, but particularly complex change like this, a kind of leadership known as transformational leadership is required. This style of leadership has been defined as one where a leader works with his or her staff to identify needed change, creates a vision to guide the change through their own inspiration and involvement, and execute the change in tandem with committed members of the group. Our leaders in some of the more successful organizations were actively involved in the process from the start. So it was a bit more than a directive from on high. It was communication and involvement with staff at every level of the process. Clear, acknowledging challenges, celebrating success and like. Similarly, the successful organizations, a key element is ensuring that there's active employee engagement throughout the process across the organization, be it a unionized or non-unionized organization. Key representatives from the organization are involved at every stage. This is most likely to occur when an organization had and used existing personnel or committees, such as occupational health and safety committees, wellness committees, and the like. And a number of organizations over time created dedicated positions, such as a psychological health and safety officer. So real recognition that this is a shared initiative across the organization. This is not something that is primarily an employer responsibility in that sense. This is an entire organizational perspective. Lastly, what really is important is to ensure that there is a real clarity about why the organization is adopting standard, and this information is shared with all staff. So I want to talk a little bit more about that one. Next slide, please.
Merv, I'm going to interrupt you again really quickly to say maybe you want to come a little bit even closer to the speakerphone. Your voice keeps fading in and out again.
Okay.
Thank
Next
you.
slide. Okay. We asked the organizations in the initial statement of interest, as well as some subsequent measures, about why they were adopting standard, what are their reasons for implementing the standard. Now, the expectation in advance by many was that they would primarily be doing this because they wanted to save money, to manage their costs and so on. Or they wanted to avoid some of the risks of some kind of legal risk that are occurring. As we know, across the country at a provincial and federal level, many new requirements with respect to bullying, harassment, and the like are emerging, and thus it makes sense for an organization to adopt the standard as a kind of mitigation process should issues arise. However, it was very intriguing when we did ask the organizations, why are you doing this? Why do you want to adopt a standard? Frankly, the main reason was a practical one. It was just a recognition that if staff are struggling within an organization, if they're not at their best, it's not good for the organization. So it's just a simple, sensible thing. We want to make sure that the psychological health and well-being of our people is maintained and supported. And if someone is struggling in some fashion, that there are resources and supports available for them in a timely manner. The second reason, frankly, was an ethical one. This particularly was reflected in those leaders of organizations who perhaps had some experience with mental health issues personally or within their family or friends, and they just saw that this is an important thing for their organization to do as part of their, frankly, corporate responsibility and community involvement. They also recognized that it was important to increase engagement of the staff and that the staff would appreciate and recognize the efforts in this part. So it was very interesting that the, we just saw a pop-up question, we'll get to that in a second. I will say that these things are not mutually exclusive. Many of the organizations had multiple goals in adopting the standard. I will comment a little bit on this one. Often the discussion is around ROI, or return on investment initiatives such as this. That's understandable, but I would suggest that a perhaps better framework would be return on expectations, which extends beyond financial output, but just the expectations of the organization with respect to participation and service to their customers, clients, and the community. Next slide, please. The second thing I want to talk about is the importance of communication. Making sure that communication is broad, effective, and clear throughout the organization. Next slide. So let's talk about that a little bit. First of all, this means that communication about psychological health and safety initiatives are disseminated across the project, across the whole process and so on. This is not just something where you send out some emails or bulletins at the start of a project, but you continue to engage staff, send out information on what's going on, being honest about what works, what doesn't, asking for input. So making sure you're maintaining that information flow via your intranet site, via a hard copy, via meetings and so on with staff about what you're doing, what the organization is doing. The other thing that made a real difference is the use of psychological health and safety language within the organization. Now, I'm going to comment a little bit about this one. Note that the standard talks about psychological health and safety, which is somewhat different from talking about mental health in many ways. While obviously mental health is a very important issue to organizations and the community at large, all too often when we talk about mental health, we really end up talking about mental illness. And when we talk about mental illness, we frequently think of those individuals with more serious and persistent mental health concerns, such as schizophrenia and the like. These are indeed very, very important issues, but are less likely to be immediately relevant to organizations themselves. When we talk about psychological health, we are talking about the continuum of health in that sense. Not everyone has a clinical depression, but everyone experiences sadness. Not everyone has an anxiety disorder, but everyone experiences stress and worry. So talking about psychological health is a real continuum approach to the issues, and I think this is reflected in some of the languages organizations use. Indeed, some organizations, as I mentioned, created psychological health and safety officers, or renamed some of their committees. Their wellness committee expanded their mandate, or even talked about psychological health and safety committee. The last thing that was really important in communication is assessing the extent to which employees are aware of and trust some of the initiatives that are going on. So for this purpose, we developed a specific measure. Next slide, please. So we created a measure of staff awareness, psychological health and safety awareness for employees measure, the phase. We can always try to get a good acronym. So what the phase does is ask staff very specifically about their knowledge and trust of a number of aspects of standard that specifically require their involvement. So the standard, if you go through actual items, there are a number of places where, in order to be in compliance, you need to demonstrate that staff are aware of what you're doing, are involved in decision-making process, have opportunities for input, as well as receiving collective information. So these are not nice things to do. These are, in many cases, expected requirements within the standard itself. And that was very, very informative. It was very intriguing that some of the items, there was a considerable variability across the items. For example, here's 2 sample items. So on. In the first case, majority of the organizations were very successful in letting workers know about psychological health safety programs. So providing information about, for example, EAP programs, benefit opportunities, training opportunities, and the like. So in general, people did fairly well in that one. However, some of the other things that were a little less known by employees were things like taking action on surveys or interviews that identified risks in the workplace. Now, I will come back to that one a little bit more, but the second element of the standard planning does require the organization to do a thorough assessment of psychosocial risks and to communicate these findings to staff. In this case, a number of organizations either hadn't conducted the evaluation or hadn't necessarily communicated staff. It's possible as well that they may have communicated, but staff were less confident that the organization was actually going to take action on these. That leads me to my next point. Next slide, please. So finally, what I want to talk about today is selecting actions that fit the actual needs of the organization, making sure that these actions that are selected are appropriate to the organization and their particular needs. Next slide. So, successful and sustained implementation occurs when actions are, first of all, based on that initial assessment that is arising through both the commitment and planning elements of the standard. So this would involve, as I mentioned, conducting perhaps focus groups, conducting employee survey, such as Guarding Minds at Work, and identifying where things were going well, where things were struggling and so on, particularly around the 13 psychosocial factors, explicitly identified in the factors. I will throw in a plug, if you will, for Guarding Minds at Work in this sense, because this is a tool that was developed specifically to look at this, and the factors identified in Guarding Minds at Work are reflected in the standard itself. Some organizations were somewhat hesitant to conduct a survey, and for some good reasons, concerns about survey fatigue. But in some cases, I think there was a fear that if we ask these questions, we may find out some things we don't want to know. Well, quite frankly, if those concerns are there, not knowing about them doesn't mean they're not there. So it's really important to do that assessment to identify where you're at, where you have your areas of concern, as well as what you're doing well. In addition, it's really important that you select actions that are based on evidence that they work. Several of the organizations selected actions that were, if you will, off the shelf. and perhaps not relevant to the risk factors they identified. I will say that, in my opinion, the next phase of development in this area of psychological health and safety is to do further research and critical research, frankly, on the kind of programs, policies, and initiatives that make a difference. And this is where evaluation comes into play. Similarly, actions need to be customized to fit the context and culture of the particular organization. So again, this off-the-shelf notion, best actions are those that may well be developed externally, but are adapted to fit the particular needs and context of that organization. I will give an example of one of our research team members, Dr. Kevin Kellaway, and one of his graduate students conducted an evaluation of a manager awareness training program in Atlantic Canada. Now, they were able to do a systematic evaluation of the program. This was mostly to, as the name implies, raise awareness amongst managers about the importance of psychological health and safety and how to take appropriate action. In this case, they were able to do a control group. So half the organization, which had multiple branches, got the training program. Half of them didn't, at least at the initial stage. And then they looked at outcomes. Now, they found that the rate of people going off work on short or long-term disability were no different between the two groups. However, the duration of time that people took off was much lower in those branches or divisions that had had the training. So I think this makes some intuitive sense, quite frankly. If a manager supervisor is more aware of psychological health issues, people may still be struggling, may need to take some time away from work. But there's more likely to be ongoing involvement, support, communication with that staff person, and therefore much more successful work return. They were also able to quantify this. As I recall, the difference was about in duration of time off was about 7 days less in those organizations, and that translated to significant savings which more than compensated for the cost of the program itself. So that particular piece of research stands as an example of conducting evaluation of programs and what works, and I think we need more of that. Finally, it's important an organization evaluate the impact of their actions. This means going beyond the traditional, for example, workshop evaluation format, which we've all experienced, what I call how are the muffins kind of questionnaire, but actually determining whether the program led to an increase in knowledge and whether that in turn led to a change in behavior. And that could be, again, I'll come back to the example of a manager training, which I think is a very important initiative. This is more than just attending a workshop. This is actually demonstrating that the participants know more than when they went in and are able to take that knowledge and apply it in their daily life. And in some organizations, for example, managers and supervisors are this is being built into their expectations in their performance reviews and so on. So really moving this to the, if you will, the shop floor. Next slide, please. One tool which I think would be helpful in selecting these actions is a guide that we created for the Mental Health Commission of Canada. And again, I think this resource is available in the links that have been sent out to you. This is something called the Psychological Health and Safety, an Action Guide for Employers. What the Action Guide does includes a number of different steps that are important in improving psychological health and safety, and then identification of particular actions for each of these steps. So this translates to 24 separate actions that are relevant to virtually any organization, are more likely to be feasible based on available financial or other resources, that are consistent with evidence, where there is actually research demonstrating they work terrific, but at least consistent with our current knowledge and understanding about workplace mental health. They're practical, they're easy to understand and to put into practice for most organizations, regardless of size. And they can be standalone. They can interact with other organizations, but they do have their own integrity and doesn't need to be part of a net larger set of programs and policies. Next slide, please. The ultimate goal, I think, in implementation of the standard is, well, I'm going to go a little zen here. The goal of the standard is not to implement the standard. The goal of the standard is to improve psychological health and safety in the workplace. The standard is a means of getting there. It provides a coherent framework in order to accomplish this. So what that entails ultimately is a creation of a culture change which may now refer to as a psychological safety culture. That's a culture that enhances psychological well-being and productivity of staff while preventing and addressing individual and or organizational problems. So again, it does involve a culture change. Next slide, please. This diagram illustrates what such a psychological safety culture might look like. This is a culture where the organizations demonstrate their concern for overall staff and looks after itself, recognize the organization is an entity that goes through changes. As I mentioned at the outset, some organizations were unable to participate in the project because they went through significant internal changes themselves. It's an organization where employees at all levels recognize their responsibility and have the knowledge and tools to look after their own psychological well-being and to care for one another. And all of these different elements interact to create that kind of safety culture. Next slide, please. So this is a quote from one of our champions reflecting exactly that point, recognizing that if they can achieve that kind of cultural change and so on, it will become fundamental, integral to this is just how we do things around here. It will not be something external to the organization. It will be intrinsic to day-to-day operations and reflected in the comments, work, and performance of all members of that particular organization. Next slide. Now, we're not quite done. While the case study research project has completed and results are available to you, with the support of the Mental Health Commission, we are doing a follow-up with 25 of these organizations to find out how well the implementation goes without some of the supports that have been provided by the Mental Health Commission and its partners. As I mentioned at the outset, during the research project, there were a number of supports, expert panel calls, other documentation, and so on, to feedback reports to the organizations to help them as they went forward. Well, the key question is now you take off the, if you will, take away the training wheels, how do these organizations do over time? So 25 of our participating organizations, which is an impressive number, frankly, I've agreed to participate in the follow-up process, which is currently underway. So we're getting them to complete the implementation questionnaire, which I mentioned earlier, as well as some additional surveys and questionnaires and interviews and so on to see how they're doing over time, whether this change is actually sustained, whether it is improved in terms of implementation, whether there are some areas that tend to lag. Find out what happens, because that's going to be the critical information to help organizations make an enduring change. So the project will be completed in the summer of 2017. Stay tuned. Those results will be available via in the appropriate process from the Commission when we're finished. Next slide, and thank you to all.
Thank you so much, Merv, for a wonderful understanding of the 3 key learnings out of the case study project. For all our participants today, as Merv mentioned, that he definitely paid a little bit more attention to the key learnings, but there are outside of the case study project 9 key promising practices that have been outlined through the project and the learnings. And for that, you're welcome to take a look at the final report on the project that's on our website at the moment. With that, maybe, Merv, we can indulge you in a little bit of a Q&A. We had the pleasure of reviewing over 100 questions that came from participants as they registered for the webinar, but also we have quite a few questions coming in on our chat function. So might want to pose a few questions for you for the next 10 minutes or so. One of them is, how do we expand or the meaning of org self-culture and self-care? What does that really mean? And you had that in your diagram a few slides ago on organizational self-care. Can we expand that a little bit in the definition?
Sure. That's, as I said, recognizing that organizations are entities. In some ways, they're like people. They go through changes and so on. And recognizing that change within an organization has an impact on everyone. So, for example, when an organization is going through a change, be it a very positive change, such as a merger, an expansion, maybe it's a challenging change due to external financial factor and so on, recognize that this is something that is going to impact the culture of the organization itself, and taking action to support both individual staff at all levels, from top to bottom, to acknowledge this change, to develop, to cope with the change, to address issues that arise. Quite frankly, one of the biggest challenges a number of organizations, not just in this study, in any study, face are things like the implementation of a new IT technology, often while the existing technology continues. This seems to be one of the biggest stressors for an organization. So again, it's identifying those kind of things. At an individual level, self-care goes a little bit beyond sort of stress management. It is both provision of the information resources, be it employee and family assistance programs, be it wellness initiatives and so on, but also providing employees with skills to look after their own well-being. My colleagues and I, Simon Fraser, have developed a number of self-care tools, primarily to deal with mood issues. Again, these are free resources that any individual can use to deal with mood issues in any context, but particularly in the workplace.
Wonderful. Thank you so much. And one of our participants, David, is asking if organizations encountered within the case study project issues or apprehension from workers to talk about their own mental illness or disclosing their mental illness, what did some of the case study organizations do to overcome that, and what might be your opinion on that?
Well, great question. Yes, that one certainly came up. It's really important to stress that these measures and the standard itself isn't about individual mental health per se. So there are no expectations that anyone disclose any personal information about their health, physical or mental, in any context. Certainly an environment where staff are more comfortable to talk about what's going on for them is likely to be a more psychologically healthy culture, but not explicit requirements or expectations of disclosure. As we know, and as reflected in the question itself, there is considerable stigma associated with mental health, and thus a number of initiatives across many of the organizations were to have programs such as mental health first aid and the like and so on to help reduce the impact of stigma. But again, there's no expectation implementing standard that staff are going to need to come forward, expected to come forward to talk about their mental health concerns.
Mm-hmm. Absolutely, and that might be even a little bit more aggravated in an environment where employees and, say, managers are not kind of in constant contact with one another. So what advice would you give to our employers around an environment where you have either multiple sites or employees and managers are not really in the same office at all times or same location? What tools might managers be able to use, and learnings from case study organizations on what they did?
That's a great point, Nitika. You're absolutely right, and indeed the complexity and the geographical and other diversity of larger organizations is a real challenge, particularly if managers, supervisors don't have the opportunity for face-to-face contact on a regular basis. I think a couple of things come into play here. Certainly use of technology in a positive sense, hopefully effective use of things like the intranet within the organization, regular bulletins and like are appropriate. And I think in those cases we're going to be even more reliant on ensuring and providing peer support, frankly, that colleagues and other staff and so on have some of the skills and training and so on to connect with one another. There also needs to be a clear mechanism whereby issues that do arise do get communicated up in the organization, or at least to someone with the capacity and responsibility for addressing them. But yeah, that's a real challenge.
Yeah, and I think one of the things that you highlighted, of course, at the very beginning, that commitment, right? Commitment is extremely important from organizations, at all levels within the organization. But I want to move the discussion a little bit more to action. So let's say you have an organization that has achieved leadership commitment. How do we really move the scale from them committing to implementing the standard to actually now starting to take action? How do we move the needle for that?
Well, a couple things. You're right. That one can be a little bit tough. And as I mentioned when I was discussing it, I think that's where the importance of the planning process of doing actual evaluation of needs, again, by a survey, focus groups, or whatever, that becomes important because you are identifying some specific issues where you do need to take action. If you haven't done any of that, you really don't know where to start. So that part's really important. And as I mentioned as well, being honest and straightforward about communicating those issues that arise through the planning process, through the assessment process, sharing that with staff. Again, I mentioned Guarding Minds at Work, and what we expect and hope for folks using Guarding Minds at Work is that they do have a commitment and acknowledgement they will share the results of the survey with their staff. I would point out that things like conducting a survey and so on are not neutral initiatives. If an organization does conduct, for example, a survey and doesn't share with their staff, the impact of that isn't just nothing. The impact of that could actually be really negative. It could actually lead to increased cynicism and distrust among staff members. So I think engaging in those processes is more likely to actually lead to action. The other thing about action, it's a good question, Inika, is to frankly go for low-hanging fruit. Go for some, if you will, quick wins, some concrete things that are most likely to be visible and successful and so on. As I mentioned, virtually any organization is already doing some things relevant to psychological health and safety. Those things may need to be highlighted or tweaked, but you're already doing something.
Mm-hmm. And this is a very interesting question that kind of, I think, ties a lot of this together. Did you notice that you showed us a slide earlier on around reasons for implementation, and you mentioned that most organizations wanted to protect, rightly so, the psychological health and safety of their workers. Now, did you find any difference between the motivation for implementation and actually what the results were, or return on investment, expectation and such? Any thoughts on that?
It's an interesting question. I mean, I don't think, I'm trying to remember our analysis where we looked at in particular. Well, to some extent, yes. What we did is, as I mentioned at the outset, we asked organizations why they were involved in participating in the standard and so on. We also did that at the end of the project. We asked champions and key informants why their organization had engaged in standard. And interestingly, we saw something of an increase in that commitment to protecting and addressing the psychological health employees. So interestingly, it wasn't like there were the motives shifted to, for example, the financial, legal. And again, I don't want to minimize those. We appreciate those important, nor do I want to suggest that these things are all mutually exclusive. Certainly an organization where staff feel engaged, or to use the current term, empowered in an organization is more likely to be a successful organization. Bit of data aside, as mentioned at the outset, I'm involved in a program, North America-wide program on psychologically healthy workplaces, and the recent data we received demonstrate a remarkably lower turnover rate and higher productivity rate amongst those organizations that had adopted psychologically healthy work practices.
Right. Wonderful. And around the sizes of the organizations, there are a couple of questions in our chat today about the different sizes of the organizations represented within the project. And is there an optimal size of an organization to be implementing the standard effectively? And in my opinion, maybe even a more comprehensive response around what are some of the practices that you learned from smaller organizations around the implementation journey?
Again, I think that's a great question. It comes up a lot. I would note that within the standard itself, there's some case studies and some suggestions as to how small to medium organizations could adopt the standard. I don't think there is an optimal size per se. I think the standard quite explicitly is intended to be available and applicable to any organization regardless of size. I think there's strengths and weaknesses, if you will, or challenges to larger and smaller organizations. While larger organizations are most likely to have, for example, a director of HR or someone responsible for human resources, I think I've read that on average an organization needs to have at least 500 employees before that's the case, and they're more likely to have some resources and maybe some programs and benefits and things like that. On the other hand, as was pointed out by your earlier questions, they tend to be more complex and there may be more detachment amongst some of the staff. Amongst smaller organizations, while they may not have access to as many resources, I think smaller to medium-sized organizations have a number of strengths in that sense. First of all, they can be more nimble. In other words, an organization doesn't need to go through layers of approval and bureaucracy. A smaller organization doesn't need to go through that in order to make changes. And secondly, I think in those smaller or medium-sized organizations, so on, there's a greater likelihood that there is face-to-face contact. If you're in a smaller organization such as, well, in our case study, we had a public library, Pickering and so on, we had a law firm and so on. If someone is struggling or there's some issues going on, it's much more likely that the key decision makers are aware of that. One piece of advice, I think, for any organization, but perhaps particularly small, medium-sized organizations, and if this is in our recommendations, promising practices, is what are often called communities of practice. So sharing those experiences and having discussion with other similar organizations in your sector or even other sectors and so on. What have they done? What has worked? What hasn't worked? And maybe a possibility to share some resources in order to develop a program.
Perfect. Now, of course, a lot of the organizations that joined us today for the webinar have also been recurring sort of participants at our webinar series, and of course they are definitely a lot more interested around the standard and have been for many years now. For those organizations, would you have any advice on sort of key activities that would produce quick wins for organizations that are wanting to implement and address workplace mental health and implement the standard?
Sure, good question, and let me even add a caveat to your comment. I think we need to be clear and honest about the case study project. Quite frankly, while it was great that we got a sample of across the country and different sizes and different types of organization, we to some extent got the organizations, it's a skewed sample. We had relatively little involvement from manufacturing, service sector, and the like and so on. So I think one of the challenges for the standard and for all of us is to reach out to industries such as mining, agriculture, and the like that may not be as aware of the standard. So a bit of an aside on that one. And that's great. That's fine. There's work to be done. I think some of our organizations, and whether they're in a study or not, can be exemplars, can be champions to other organizations, and should be very proud of what they've accomplished. Quick wins. Well, again, as I mentioned earlier on, I think looking at some of the things that you're already doing or are planning to do, and framing that, seeing if there's something you can do to improve or ramp up uptake. As I mentioned, if I were to make two recommendations, and again, not falling into what I said earlier, sort of taking things off the shelf, but I think the best actions ideally fall into two categories. I think some need to be at an organizational level and supporting the organization. Some need to be at an individual level and supporting the individual. So for example, well, we've already talked about this. At an organizational level, I think providing support and information for managers and supervisors is really key. And there are a number of training programs and information programs for managers out there. What I think is often missing is recognizing that managers and supervisors themselves have their own challenges within their workplace. So what is missing is support for those managers and supervisors in what can be a very demanding, very stressful role. So that would be one at an organizational level. And we also talked about this on an individual level, providing access to self-care resources. Again, there are a number of tools and programs out there that are free and easily disseminated and very practical. What that also reflects is, in order to move forward, it does require both the individual commitment as well as the organizational commitment. This is not an us or them issue. And I guess my last comment with respect to that particular question is, again, clarity of what you're trying to accomplish. Why is the organization engaging in this process and communicating that to staff? So it's not just about saving money.
Mm-hmm. Perfect. Well, thank you so much, Merv, once again, for all the great wisdom and all the wonderful wonderful comments around the standard and around the case study project and your learnings. We, of course, had many, many more questions than we were able to take today. So if anyone is interested in asking further questions, I encourage you to please email us, and we'll do our best to send you our responses. But before we kind of end today's webinar, I do want to highlight for all the participants today that we have been creating certain tools and that are free to access and as well as bilingual in English and French. These are around the 13 workplace factors, and we've created short videos, snippets of the factors and what do they mean and how can employers as well as employees can play a part in promoting those factors. They're available on our website and for anyone to take a look at. And what we have found organizations being very useful in these videos is that they've taken them and done lunch and learns with their employee focus groups and such to talk a little bit more about the factors that they're struggling with and to come up with their own unique solutions on how they want to address those factors in their workplaces. I do also want to acknowledge that we are creating some employee orientation tools and online tools for organizations to help them implement the standard further, and they will be available in the near future as well for organizations to access free at no cost. So once again, before we head into the end of the webinar, I do want to thank you, Merv, for your time today for walking us through some of the key findings. I do also want to inform everyone about our ongoing webinar series to join us on an ongoing basis last Wednesday of every month and register for future webinars. And we have some resources here for you to take a look, and these slides will be up and running on our website in a couple of weeks. Finally, I want you to please take the time to provide us with your feedback on how we did for our webinar today, if the information that was provided was useful, and what would you like to hear from us from future webinars. And as we move forward, I just want to highlight for you that there's a video link that we had shared for you in our chat function that really does highlight the learnings from some of the case study organizations and the benefits as they see in having implemented the standard and their return on investment or expectations out of the standard. We're happy to play the video here on our webinar today as well, but we have resent you the YouTube link to the video. We encourage you to watch it. We do encourage you to let us know if you have any comments, any feedback on that. And there are certain other videos on the YouTube channel as well that highlight specific information on key organizations and their journey, what did they do to implement the standard, as well as some of their outline learnings and advice for other organizations. You're happy to sort of look at the sector or industry in which you're in. I know we got a question around education sector. There's a video in there from Carleton University that you might want to take a look at, and certain other sectors and industries as well. With that, I do want to say thank you all for joining us. My email address as well as Merv's email address is on the slide here today. If you had any questions, I'm happy to answer them for you, and the resources will be available on our website. And if you have a few more minutes, we'll be playing the video here, and otherwise, we'll see you next month at our next webinar. Thank you.